Awesome. All right. Hello, everyone. Welcome. First and foremost, I just want to say this is kind of our culmination to Minority Mental Health Awareness Month. And so, being someone who does a lot of advocacy and health education work in terms of BFRBs and mental health equity in general, I wanted to put this together as part of Club Imani's official launch as a charitable program. So, kudos to you all. You are here. This is like our first main big event. And so, super excited to bring this offering to you all. So, I do want to just talk very briefly about Club Imani. And so we are igniting courage, promoting collective healing, and empowering Black and Brown communities living with body focused repetitive behaviors, or BFRBs, as well as related disorders to imagine healthful futures, um, particularly through a cultural rooted lens. And so we are here. The support group started back in 2020. The support groups started back in 2020. You might remember me if you were a part of the original support group. But since we wanted to do bigger, better things, and so we certainly thank our fiscal sponsor, BFRB Changemakers, and Anila Adnani for supporting us, supporting our endeavors, so that we can go out and get the grants and do all the things and just be super, super, yeah, have good fun, share the good news. A little bit about me. I'm a public health doctoral candidate, health coach, and digital performance-based and digital storyteller, passionate about health equity in healthcare settings and public health program and policy design, implementation, and evaluation. As an arts and health practitioner and certified health education specialist, I weave creativity and storytelling into my work, unearthing and the fundamental causes of health inequity, helping communities share their stories and co-create healthful futures together. So my areas of expertise include mental and behavioral health, chronic illness, reproductive justice, healthcare service delivery and evaluation, liberatory care, social determinants of health, cross-sector collaboration, nonprofit leadership, arts-based research, digital storytelling, theater of the oppressed, as well as health education program development and implementation. I'm also the director of Club Imani, and do a whole bunch of other things. But today is not about me. I invited my dear friend, Dr. Marla Deibler, to facilitate this webinar for you all today. So I'm going to go ahead and introduce her. So Dr. Deibler is a licensed clinical psychologist, board certified in behavioral and cognitive psychology. She is the founder and CEO of the Center for Emotional Health and is a nationally recognized expert in anxiety and obsessive compulsive and related disorders. Dr. Deibler serves as faculty of the Behavior Therapy Training Institute of the International OCD Foundation. Dr. Deibler also serves on the board of directors of OCD New Jersey and the New Jersey affiliate for Tourette syndrome and associated disorders, as visiting clinical supervisor at the Rutgers University Psychological Services Clinic, and on the executive council for the Association for Contextual Behavioral Sciences, OCD Special Interest Group. She is the author of the BFRB Recovery Workbook, a step-by-step guide for effective recovery from hair pulling, skin picking, nail biting, and other body-focused repetitive behaviors, which I do own, and I love that book. And the forthcoming book, Free to Be Me with a BFRB, The Ultimate Kid's Guide to Living Well with Hair Pulling, Skin Picking, Nail Biting, and Other Body-Focused Repetitive Behaviors. So, without further ado, I will pass the torch over to Dr. Deibler and we'll go ahead and get started. Thank you.
Well, thank you, Saharra. I really appreciate you inviting me for this today for what I didn't know was your big inaugural event. So this is really exciting. Thank you so much for having me, and thank you for supporting the community and creating this space for them. It's really wonderful, and I'm happy to be here to support it too. All right, these are my disclosures. I do a lot of clinical training. I've written some books on the topic. I'm not compensated in any way for doing this today. It's just meaningful to me. I do a lot of that kind of work too. Okay, So this course is a little bit different than others in that unfortunately not very much attention has been historically paid to understanding the ways in which body-focused repetitive behaviors manifest across cultures or to address the disparities in care. And so today is a little bit different because usually I'm talking a lot about the research and clinical application, but we don't have a lot of research. So we're going to be reviewing the little research that is out there in a bit, yes, but we're going to approach this as more of a discussion and an exploration of why we believe that cultural beliefs and practices can be very much relevant to BFRBs and may serve as a barrier to care so that we can move toward breaking down those barriers and improving care. And that being said, I myself approach this topic with cultural humility and openness and eagerness to learn from everyone's experiences because everyone does have their own experiences in their lives so that we may better understand. And I'd like to begin with a little video.
If there is sound, I can't personally hear it.
We can tell that hair is really important to people is by how much time and money they spend on it. And it's obviously.
Are you able to hear that sound?
Yes, we can hear it now.
Okay. Oh, but wait.
Now we can't.
We can tell that hair is important to people is by how much time and money they spend on it. And it's obviously a multi-billion-dollar industry.
Volume.
People spend enormous amounts of time dyeing their hair, washing their hair, getting their hair cut. And that's just the hair on your head. Our modern society, where women are encouraged to pay a lot of attention to their hair, that's really in line with most of world history. Hair as a beautifying agent has had a tremendous importance for humans in many civilizations. It is associated with sexual power, with virility, as in the story of Samson, who lost his power after his hair was cut. Loose flowing hair, especially on a woman, seems to be perceived frequently as symbolic of sexual license. You find both the religious authority and the state authority very concerned with controlling people's hair. Under some circumstances, the cutting or shaving of hair implies that the individual is being disciplined or subordinated to some larger authority. After Paris was liberated from the Nazis, many French women who had slept with Germans had their heads forcibly shaved and were marched through the street. Hair is so associated with femininity and with beauty. It really becomes almost an unspeakable thing for women when they have hair loss.
So this is a clip from a really wonderful documentary, an oldie but a goodie, I might say, from 2003 called Bad Hair Life. And I just wanted to sort of introduce the greater concept of the idea that hair has a number of meanings in so many different cultures and has been used in many different ways. So hair is really more than a biological feature. It's a symbol. It's a symbol of identity, of belief, of power, and across cultures and history, hairstyles have reflected religious devotion, values, and social roles. Society often assigns the meaning of hair from professionalism to rebellion to spirituality. But hair has also been used to enforce control with forced shaving and strict grooming codes, stripping people of their individuality. Whether a tool of expression or oppression, hair tells a powerful story of culture, history, and social meaning. And we internalize that meaning over time. The meaning can vary depending on who you are and the communities in which you've participated in your life. Across cultures, hair marks a rite of passage in many places. Life transitions, expressions of identity. It can signal belonging to groups, from punk styles to traditional African designs. It can carry meaning beyond the body, woven into memorials or symbols of devotion. Hair also reflects gender and sexuality for many, with styles used to express femininity, masculinity, nonconformity, or LGBTQ plus pride. More than strands, hair is a powerful form of expression and connection for many people. And so there's a lot that goes along with the time and effort that we put into just the stuff on our heads or on our bodies. Hair has been a long time powerful symbol of identity, of resistance and tradition across cultures. In African American history, hairstyles served as silent resistance during slavery and later became symbols of pride during the civil rights era. In many Asian cultures, hair reflected social status and devotion, as seen in Imperial China's long hair for filial piety and the samurai top knot in Japan. For Indigenous American communities, hair represents spiritual strength and ancestral ties, with long-standing long hair symbolizing wisdom and rituals like braiding, reinforcing cultural bonds. I'd like you to hear a little bit about that from this gentleman.
In different ways and with different descriptions, a lot of Native people will talk about hair as a source of spiritual strength. It's something that is an intimate part of being. But also with hair, it's a way of saying, I am proud of and connected to and recognizable to my ancestors. And so it's just an identity affirmation. For some tribes, there's even a taboo about having someone who is not family braid your hair or things like that. Leonard Boos, who's one of our elders from Mille Lacs, he just passed away recently. He said when they were kids, if someone had a haircut, like I had a braid chopped off, they'd take the braid and they'd run it across a hot rock, and it was like cauterizing a wound. He said, so your medicine wouldn't leak out. Hair is also something that speaks to identity. So if I have a short haircut, I could easily pass as Hispanic, Filipino, maybe Arab, Greek. But with braids, it's pretty obvious that I'm a Native man. And it's also something that many Native people wear as a way to counteract their experience with invisibility. It says, here's who I am. You can imagine then the experience for people who had either spiritual or cultural beliefs about the importance of hair or saw it as an important marker of identity, then, you know, the experience going to residential boarding school and having your braids chopped off on the first day, or schools, as there are still like public schools that require boys to have a haircut above the collar.
or engaging in behavior that does damage to the hair, like pulling it out. Hair and head coverings also hold deep religious significance across cultures. In Orthodox Judaism, for example, married women cover their hair for modesty. Men wear payas, or long ringlets, you've probably seen, as a religious duty. And a boy's first haircut occurs at age 3 and marks his introduction into faith through a ceremony. In Islam, facial hair symbolizes strength, while head covering, like the hijab, reflect modesty and devotion. In Hinduism and in the Sikh traditions, veils and turbans represent respect and faith, with Sikhs keeping uncut hair as a sacred practice. So across these traditions, for example, and of course there are many others, hair and head coverings serve as powerful expressions of faith, identity, and cultural values. Skin and nails are not very much different. Skin and nails, like hair, are powerful symbols of identity across some cultures. Cultural practices like tattooing, like piercing, like branding, nail art reflect beauty and status and tradition, and conditions affecting them oftentimes add to the stigma that people face. Social media now shapes evolving beauty standards, influencing self-image and cultural perceptions of what beauty is globally. So I want to pause for a second, have a moment of discussion, and I apologize because I'm sharing my slides. I can't see anyone, but I know that there are some folks there. So please feel free to share either by unmuting yourself or dropping in the comments if you're more comfortable with that. What symbolic meaning does hair or skin or nails hold for you, and how were those meanings derived from the cultural groups that you belong to or you identify with, and how does that impact you?
Give folks a few minutes to think. But yeah, feel free to share your responses. You can either unmute or you could share it in the chat as well.
You can also just share observations. What do you notice in others? What do you notice in the communities? What were your thoughts on the videos of people from different cultural groups talking about the meaning for them?
I'll get us started. I think the videos were really interesting. I'm going to go back to that 2003 one and try to watch the whole thing because I think we all, in a way, understand that hair, skin, nails hold meaning, but we don't really get the chance to kind of really dig deep. So I really appreciated the chance to do that. I think for me, culturally, as a Black woman, since I came out of the womb, hair has been so, my hair specifically has been so dictated. I wasn't able to do my own hairstyles until like after I graduated high school. My mother wouldn't let me dye it. She wouldn't let me perm it. She wouldn't, she was very, I wanted to do like different funky little like hairstyles and haircuts. And she was like, no, absolutely not. I'm dictating it for you because I know what's best, because I know what looks good. And because you are a Black woman, you do need to look a certain way, present a certain way so people can take you seriously, as well as, the whole beauty factor, which I think certainly all women understand. But I think being a Black woman, there is such a gendered and racialized component as well. And then I think Carolyn has something in the chat. I associate clear skin and long hair, braids or otherwise, with health and beauty, which has only been exacerbated by the social media era.
Yeah, thank you both for sharing. We're going to get to both of those things. We're going to talk about intersectional stigma and we'll talk about social media. Yeah, for sure. Well, let's talk about perceptions of beauty across cultures. Let's talk about social media, shall we? Beauty standards are often influenced by social media and celebrities. Some common features of beauty are displayed here. Let's take a look. There is no volume with this one, by the way. I removed it because it's really not necessary to hear it. So this was a project to demonstrate ethnic diversity of humans and the view of beauty. But you'll notice something as you look at all these beautiful photos. The intention of this video is to demonstrate diversity and beauty. But really, there's a lot of the same. I see a lot of the same with slight variation. What I see in this is that there are some common features here. We're talking about symmetry. We're talking about really clear skin. We're talking about youthfulness, right? All of these women are very young and have very similar features, even though they might be different colors, which I think is fascinating. And this is a standard that we all are held to. Yeah, and mostly straight hair too. Yeah, I hear ya. Yep. And hair is longer, skin is clear, right? These are beauty standards, whether they're spoken or unspoken. So let's talk about social media and cultural trends. Let's look at this. The wonders of Photoshop, right? This is what we're presented with. She starts off looking pretty natural, pretty average person, really. But so many digital tools were used, and she, in the end, looks kind of not human, definitely not realistic, right? And these are the standards to which young people in particular are comparing themselves because these are the image presented to them as the ideals of beauty. So question for you. How much do you think, you can shout it out or put it in the chat, that's fine. How much do you think was spent in the beauty industry last year? How much do you think it was worth? Take a guess. All right, I'll tell you. $374.18 billion were spent in the beauty industry. Yeah, I know, it's a lot. It's a lot, right? Rachel thought there in the chat that she was shooting high probably with 100 billion, but that was last year. And the global cosmetic market is projected to continue to grow to 758.05 billion by 2032. It's outrageous, isn't it? We've all seen videos like these. I won't even play the whole thing.
If you're just starting to learn about makeup but don't know how to highlight or contour your face, watch this. I'm Alex. I'm a Saint makeup artist, and my page is all about beginner-friendly makeup tips. I'm going to be using my custom all-in-one makeup palette. We're going to start with our contour at the top of our forehead, along the sides of our cheekbones and our jawline. As you can see, I didn't go past the outer corner of my eye. Now we're going to draw two parallel lines close to each other on the top of the bridge of your nose. And this technique is just to lift your nose a little bit. Now we're doing concealer on the center of our forehead and between our eyebrows, down the bridge of your nose, the tip of your nose, the inner and outer corner of your eye, your cupid's bow, and your chin. And then we blend everything out in its place. I like starting with my contour first and then my concealer. Remember to blend your contour upward along the sides of your cheekbones. And now we blend our concealer. So the point of highlighting and contouring is to brighten up and add dimension to your face. Because our faces aren't just flat and one-dimensional, so adding that one color foundation all over your face really won't accentuate your natural features. That's it, and don't forget to follow for more beginner-friendly makeup tips.
We've all seen these contouring videos probably, right? To try to achieve this unrealistic expectation of beauty, right? Your nose should be small and it should be straight, and you should have highlights in certain areas, and you shouldn't have bags under your eyes, and you should have high cheekbones, right? We are using product and we're spending billions of dollars every year to try to conform to these images that aren't even really real. You know, whether they're digitally altered or whether they're AI these days, or whether, you know, we're doing things to try to camouflage our natural look to try to conform to what we see as, or what we're presented with as the ideal is, it's surprising. Okay, I want to show one more clip here. This is Lauren McKinney. If you're not familiar with Lauren, Lauren is a fantastic human. She's an incredible advocate for BFRBs, and she runs a nonprofit organization called the Picking Me Foundation. She has excoriation disorder, which is a skin picking condition that has led to very serious effects for her, including a MRSA infection and nearly the loss of a leg. This is her talking about the way that she experiences how skin products are presented.
And if you look at an aisle about like a beauty aisle or a soaps self-care aisle, check out how many bottles targeted towards women, creams, lotions, concealers, face wipes, etc., say for the clearest skin or to clear your skin. There's this idea that this porcelain canvas is what we should be after and what is most acceptable. And that's affected my journey with my skin and my identity from middle school, and making sure that I had at least 9 different concealers always in an area around me, just in case something happened, I could quickly cover it up and make the skin clear again, so that, you know, it was easier for people to handle looking at me, I guess. But now, in embracing the dots, embracing my skin is my skin.
So, wow. So first of all, good for her for coming to a place of self-acceptance. But wow, using these kinds of products so that people can more easily look at her. Wow, the impact of that. The pain that is there and must have been there. How do you think Lauren feels after seeing skin contouring videos and these unrealistic, digitally altered images on the internet? Talk about shame and stigma. So let's talk about having a BFRB across cultures. I did say that I would cover a little bit of research, so I do want to touch on that just a little bit, because you're curious. This is literally all that's there in this field at this point. So studies do suggest that skin picking is a widespread behavior with consistent patterns across cultures through a lot of different kinds of cultures. And for example, in this German study, skin picking was a highly common behavior among students, with 91.7% reporting occasional engagement. in the behavior and 4.6% meeting clinical impairment criteria, particularly for cuticle and skin picking of healthy skin. That's a lot of people. In Turkey, skin picking characteristics varied by gender. Men tended to start earlier. They tended to pick their legs more often and reported greater pleasure, while women more often picked at their chins. In a study of Jewish and Arab Israelis, skin picking disorder had a 5.4 lifetime prevalence rate with no gender or ethnic differences, but was strongly associated with greater psychological distress and comorbid conditions such as depression, OCD, substance use, and such. We see very similar data in terms of prevalence and the impact of these disorders across cultures with the little information that we have to date. These studies highlight cultural influences on BFRBs and treatment preferences. So in this Polish study, skin picking disorder affected 7.67% of young adults, with nearly half engaging in the behavior, low rates of help-seeking behavior, and a preference for dermatological care over psychological treatment, pointing to cultural perceptions that may minimize its mental health relevance, or perhaps demonstrating that we need to go to the places where people are more likely seeking resources and support. In this other study, among African American women with trichotillomania, higher symptom severity was linked to anxiety and OCD symptoms, and cultural messages about hair, like the judgment of good hair versus bad hair, played a significant role in their symptomatology. And many preferred to seek treatment from hairdressers rather than mental health professionals, underscoring the need for cultural sensitivity in approaching care, and also going beyond our traditional care spaces to the places and people that individuals who are struggling with this find most comfortable in order to present them with a greater access to care. So, people like Bianca Leiter, I don't know if you're familiar with Bianca, but Bianca Leiter, who is a cosmetologist and a hairdresser in New York, she created a nonprofit organization helping to essentially introduce the idea of addressing BFRBs for Black women in the spaces of hairdressing salons and cosmetology spaces, specifically set to serve the Black community. Fantastic. Couple of more research studies. These studies highlighted racial and ethnic disparities in the experience and treatment of body-focused repetitive behaviors. One study found that while minority participants benefited from in-person habit reversal training, which is a specific kind of training, treatment for the disorder, at similar levels to white participants, they showed less improvement and lower satisfaction with web-based self-help strategies, suggesting a need for culturally tailored digital interventions as well. There's a need there that doesn't exist. Similarly, this other study reported that BAME individuals, those are individuals that identified themselves as Black, Asian, and minority ethnic, engaged in BFRBs with more frequency, targeted different areas of the body, and were less likely to access mental health treatment, often turning to hairdressers again instead, despite having similar symptom severity, underscoring systemic barriers to care. Last couple of studies. These two studies explore trichotillomania in African American populations. One study found similar trichotillomania diagnosis rates between African Americans and non-African Americans in a college student population, but noted that African American women in this sample reported more visible hair loss and pulled their hair more often due to itchiness and inflammation. Cultural factors and hair care practices, it was concluded, might influence the experience and expression of trichotillomaniac symptoms, emphasizing the need for culturally sensitive interventions again. And the second study looked at students from a historically Black university and found lower rates of hair pulling compared to white samples with minimal reported distress and low treatment-seeking behaviors. Hair pulling was often triggered by boredom or anxiety and provided relief or indifference, correlating with anxiety but not depression. And those findings suggest the under-recognition of trichotillomania in African American populations and highlight the importance of culturally informed assessment and outreach. And that's pretty much all we have specifically in the BFRB space, with the exception of some information about intersectional stigma. But before we get to that, I'd like to show you this.
Dr. Neil Barnett. She was an African American woman studying trichotillomania, and I just read article after article what she posted about it. And I specifically wanted to know about me because, for Black women, your hair is your crown. Like there's, sitting between your mother's legs, getting your hair parted and dug in your forehead and burning your ears, and there's rituals to this.
Yeah.
For us to end up on the other side of having this confidence around our hair. And so I didn't really have to go through the natural hair thing because I'd always kept my hair natural. But there was nobody talking about pulling out your hair. And so when I found out that there was a name, something lifted. And then something still was closed. Like now, and there's a name for it, but like you Google it, none of these people look like me. I went to a conference on it once.
It's so important to have representation. It's so important. Let's talk a little bit about shame and stigma. I said that was it for research studies, and technically it is, but we're talking about related things at this point. Shame and BFRBs. We know that BFRBs are complex, and the emotional experience of having a BFRB and engaging in BFRBs are complex. For most people, it serves an immediate self-regulation function, right? We do things because it serves a function. And for many people, the initial emotional experience at the immediate moment after engaging in the behavior is associated with increased feelings of pleasure, relief, gratification, decreased boredom. But then over time, that changes, and those emotional experiences turn to anxiety, anger, more difficult emotions to sit with, shame, low self-esteem, feelings of unattractiveness, and other kinds of consequences as well, like strained relationships, depression, secrecy. And we see this across different cultures as well. The American data, for example, and the Italian data in this example here up on the slide are very similar in terms of the emotional experiences, in terms of the short-term impact and the long-term impact. And the long-term emotional impact, that shame, the sadness, the frustration, the decreased levels of calmness, even though initially it feels for many people calming and pleasurable. Those long-term impacts fuel the behavior because it is an attempt at self-regulation for many people. And so it becomes this self-reinforcing cycle. And shame results from that. So studies indicate that associated with BFRB symptom severity and distress are body dissatisfaction, that when we target shame and perfectionism specifically, and giving people emotion regulation strategies, that can be helpful. And we find that shame and the importance of addressing emotion regulation is an important aspect of the experience of the antecedent to a BFRB. In other words, what triggers the behavior. So let's talk for a moment about intersectional stigma. I mentioned it earlier today, and Saharra mentioned it too without saying the words, but she mentioned the experience of intersectional stigma. So intersectional stigma, if you don't know, is the combined impact of multiple stigmatized identities. Like, for example, identifying as LGBTQ+ and also having a mental health condition like a BFRB. which together create greater discrimination and distress as an experience than any single stigma alone. So we see this kind of piling on of distress and therefore also piling on of impairment in one's life and in one's communities. And we see this emerging BFRB data here. This is actually out of the UK, in increased distress and impairment, as well as decrease in help-seeking behaviors and poor treatment outcomes. So to realize its full potential for improving health equity, a closer look at the concept of intersectional stigma and those individuals' experiences has to be more fully understood, and how it relates to the potential for improving health outcomes. What we need to do when people are experiencing, again, this intersectional stigma, this combined impact of having belonging to multiple stigmatized groups. And that impacts help-seeking behaviors and the ability to find culturally competent BFR treatment providers. So one of the things that we have to do, these are my own thoughts here, is that we need to reach people where they are. We need to have these online communities available to people. It's hard to access good informed support, whether it's treatment or whether it's peer support. Having online communities available to people of various cultural groups where they might not be able to access care in person. Going to community activity centers where people congregate, right? Going to recreation centers and community centers and ethnicity-specific education centers, right? Where people are living their lives. In spirituality-centered spaces, right? We need to be going into these spaces to provide them with education, to provide them with care and support in a way that is specific to them. Going into hair salons, what Bianca's doing with her efforts is fantastic. If African Americans are less likely to seek treatment in the community, but they're more likely, as we've seen through the little bit of research that we have, to talk to their hairdressers, we should be going to the hair salons, right? We should be going and talking and educating the hairdressers to be informed, to have resources available when this does come up, because it does come up. We need to be going into community-specific service areas to be able to provide people with the support that they need. And I swear I made this next slide before Saharra invited me today, but she's on my slide. I think it's important. Representation matters. We need to be able to see the manifestation of lots of different kinds of experiences across ethnic groups, and seeing advocates that people can identify with. Someone who looks like them, someone who talks like them, someone who comes from spaces like them and their communities. People need this in order to feel more accepted, more willing to access care, less fearful of being judged, and less and more willing. So it's very important to have representation. So this is a really great example, I think, of how, there's, especially with BFRBs, there are so many other kinds of people in the communities that can be useful resources to people, not just us mental health providers. We're a piece of the puzzle, certainly, and we can provide treatment, but there are other people and other places where it's important to be able to get out good, reliable information to even let people know that this is a potential problem for which people can get support and help. So this is just a really great example. I like this gentleman and his video a lot. He is a trichologist, and he has a YouTube channel and wanted to show people his thoughts on hair pulling. And I love how destigmatizing this is.
What's going on, world? This is your boy B. Welcome to another episode where the truth lives here. On this episode, I want to talk to you guys about my boy Bob. Bob came to me, and one of the issues that he was having was he started to find these gaps in his beard that he hadn't noticed before. Prior to, he had a pretty full beard. Then after, all of a sudden, months go by, he started to see like, man, my beard is, I'm developing these patches. Well, upon just talking, having a conversation with Bob, we began to uncover that he was dealing with a lot of stress, a lot of anxiety. Of course, he's, through this whole pandemic, he had lost his job. Financially, he was just strained. His marriage was on the line. So he was just dealing with a ton of stress. And with trichotillomania, which is, which basically means you just start pulling out your hair, and you're going to pluck your hair out to deal with negative feelings such as stress. In Bob's case, he was dealing with stress, he was dealing with anxiety. And some people, you deal with depression, loneliness, fatigue, and you'll be pulling your hair out, and unbeknownst to you, you don't even notice that you're doing it, but it's just a response, a reaction to what's going on in your life at that particular time. Now, again, some of the signs that you'll be able to notice: you can't stop pulling your hair. If you become conscious of it, if you're just touching your beard or your brows or even your scalp, and you become conscious of it, and even though you become conscious of it, you still can't stop doing it because that's your way to cope with the feelings that you are having with the stress and so on and so forth. You start noticeable hair loss, right? And in Bob's case, he started to notice in his beard, he started to notice patchiness. So he started to experience some loss of beard hair. Number 3, chewing on the hair. Some people, especially if your beard is a little bit longer in this particular area, you can find yourself chewing on your hair, or you can be plucking your hair out and finding yourself chewing your hair. You might think that's pretty weird, but things like that happens. It's just a way that people are coping and dealing with these negative feelings. Another one's biting on their nails. I mean, I've noticed people, especially before the game, I've noticed some of my teammates, they would bite my nails, their nails, not my nails. I used to bite my own nails, and I didn't realize that I would do it often, but I began to understand that a lot of that had to do with my own anxiety and stress that I was feeling at that particular time, and biting my nails was just a way to cope with it. And then chewing on your lip. Some people, if you notice, some people who chew on their lip, if you talk to them and they be chewing on their lip like that, that can be also a sign of trichotillomania. Now, how you can treat this is by going to a therapist. That's going to be the number one way you're going to be able to treat this. Go to someone who's professional that can help you through your anxiety, that can help you through your stress, that can help you through your depression. And that way you can solve this right away. You don't have to find your hair, you're losing your hair because you're pulling it out, plucking it out. Your eyebrows is getting thin because you're plucking it out, or even your beard is getting patchy because you're plucking it out. Get to the root of it. See a therapist. If you enjoy this particular...
I love this. It's so direct. It's so honest. It's so destigmatizing. It's so matter of fact. Like, hey, this comes up. I see it. There's hope for this. It's fine. This is not anything unusual, and it's okay to have this experience. I love that. So there are a lot of things that we need to do, and we need to do better, honestly, in mental health treatment. But here are some thoughts on the way in which we need to be addressing shame and cultural factors in treatment. We need to make sure that we're setting for ourselves a standard of having a foundation of cultural competency for therapists, period. Having a good understanding of the ways to reach people in the spaces and places and experiences that they have. Providing psychoeducation to the client and the support persons as warranted in their lives too. Working on willingness, working on mindfulness, working on acceptance, and the degrees of how close they are to readiness and willingness is going to vary from person to person, and for one reason or another, including the experiences that they've had. Examining shame and where their shame comes from, examining where their shame lives in their life currently, developing perspective-taking skills, examining their belief systems, where those belief systems came from, developing perspective-taking and challenging some of those beliefs if they're not useful to them, or if they are useful to them, then maybe perhaps holding on to those belief systems. Emotion regulation and distress tolerance skills. We talked about, the fact that we see that this the emotional factors are at play in terms of being antecedents and reinforcers of the behavior. So making sure that we address that as appropriate for each individual. Giving person intrapersonal and interpersonal effectiveness skills, because this is a system, whether it's our own internal system and how we work or how we interact with other people, learning to set limits with people, being able to effectively ask for what we need. And get our needs met in ways that are helpful. Engaging in values-oriented action, right? Being able to continue to move towards the things that are important to us from person to person, regardless of what's showing up on the inside, including our own distress. And connecting people with community support. Community support is important for a lot of different struggles, but I find this particularly important and always have for BFRBs because they are so much associated with shame and secrecy and embarrassment. And it's so important for destigmatizing the experience and for helping people to move to a place where they're accepting of themselves and being able to move more toward the kind of life that they want to live rather than getting overly caught up in their experience of BFRB symptoms. So I have some other slides, including some references, but I want to throw these questions out to folks, and I'm gonna leave them up here for a second, but then I'm gonna stop the share because I want to be able to see people and have a couple of minutes of discussion as well. So what are your experiences of living with a BFRB as they relate to the facets that you experience of your identity? How has shame, stigma, and the narratives from your life impacted you? And are there ways in which intergenerational experiences influence how you seek and access support? Feel free to unmute chat. If you're not comfortable with that, you're welcome to drop it in the chat as well. What are people's thoughts? Or what are your thoughts, Saharra?
Yeah, I can definitely get us started off. I definitely resonated with the young lady. I forget what her name was, but the young Black woman in the earlier video. I think she was like recording a podcast or something with someone. And, for me, very similar, um, I in time, I found a name for my trichotillomania, found the name. Great. Awesome. I start Googling resources and I'm seeing that and there is no one that looks remotely like me. No one that I feel necessarily comfortable really, yeah, seeking care and getting help. And eventually I bit the bullet and I eventually actually sought care with CEH. And that was really transformational for me. But eventually I did decide I wanted to have a clinician or therapist that not only shared racially, ethnically, but also sexuality as well. And so that has been really important for me. And I know just in my work with my research with Black women and femmes with BFRBs and just some of the stories that they're telling that is such an integral part to them seeking care and feeling comfortable in seeking care. But we also know that, statistically, there are not as many Black psychologists, therapists, counselors. We do have a lot of licensed social clinical social workers. But nevertheless, still, it's far and few in between. A lot of the women that I work with, and people in general are just like, I'm coming up against one, just in general, no one knows what BFRBs are. And then you take that to my identity. There's a lack of folks who I feel comfortable sharing my experience with that also know about BFRBs as well. And so there's a lot of like misinformation or just the BFRB kind of gets put on the back burner. And as BFRBs are highly comorbid with a whole bunch of other things. And I think in my work as well, a lot of the women I'm noticing are neurodivergent, might struggle with ADHD, or might be autistic. And so you take all those factors into consideration, and obviously we're being, late diagnosed, very late diagnosed, because there is no research truly on Black women with like ADHD, Black women with autism. If there is, very far and few in between. So you take all these kind of things into consideration, and it kind of creates this like cluster mess of where do I go? How do I seek support? How can I all the things and all my needs kind of be met? And the social aspect of that. And then that's kind of where I come in is wanting folks to release shame and release stigma, share stories, share, and so that we can kind of control our narratives, control our oral histories. And so, yeah, I
Yeah.
resonate with everything that was shared, all the videos. It was really powerful to see that Black man. I think we're trying to like reach more Black men, or just men in general, honestly, which is its own can of worms. But it was really nice to see like a young man kind of talking about it as well. And I know Carolyn just put something in the chat. I can read it out loud if that's helpful. So, skin picking, nail and cheek biting have all been part of my life, but it has been dismissed intergenerationally and even clinically because they don't understand it or why the cycle can't be interrupted. I find that some folks are of the mindset of accepting it, but others encourage people affected to address the root causes as best as possible that has felt confusing too.
Yeah. I think, Carolyn, you're not unique in that experience. I think a lot of people share that experience. And it creates additional barriers, doesn't it? Even within yourself, right? There's ambivalence on a number of levels about seeking treatment, right? And as Saharra was saying, yeah, I mean, we're lacking in diversity in therapist community as well. We representation in our communities matter too. Sometimes people want to see people who, share their cultural experiences. And I know that if I were seeking treatment, now, myself being from a highly stigmatized ethnic group, I would personally want someone who was from my ethnic community. I would absolutely feel that way. So I can relate to that for sure. Yeah. There's so much to work on. Let's not talk about the that's a whole other discussion why academia is not as diverse as it should be. That's a whole other can of worms. Yeah. And then we don't turn out professionals in the community that, represent our actual population. It's a problem.
I don't have much else to add, but I do have to go in a second. But I am wondering, as a Black woman, so what? Like I feel like there is a lot of conversation starting to happen around it, which I'm grateful for. But when there aren't resources, therapists, all these things, I did no CD, I did brain spotting, I did EMDR, I've done it all. But nothing has, I was just doing some research and they talked about habit reversal training. Um, yeah, I think my question is, so is there a solution at this point? I think
Yeah.
it's hard. Yeah, I think
Mm-hmm.
that's
Yep.
all.
It's a good question. So habit reversal training, or HRT, is sort of the original, the OG treatment for BFRBs, dating back to the late 1970s. There are more contemporary approaches to treatment that are a little bit more inclusive of other factors that we know are relevant to BFRBs and how chronic they can be. I think realistically, at this point, we don't have a cure. For people, it tends to sort of wax and wane, but with treatment, with decent evidence-based treatment, something based in, a behavioral model, people can live the kind of lives that they want to live, minimally impacted by whether or not their BFRB is active. So we can help people learn to manage the experience. Kind of like we might do with, we think about mental health in some ways different than we think about medical problems, but really they're no different. There's such a double standard and so much more stigma around mental health. But if you think about it like, if someone is born with type 2 diabetes, right? They're not going to get rid of their they're not going to get or type 1 diabetes, excuse me. If someone is born with type 1 diabetes, right, they're not going to produce the proper amount of insulin. Their bodies just aren't built like that, and they're always going to require some medical treatment. But they can learn with a good treatment team to manage that effectively and have minimal impact on their life. They will have to pay attention to it, and they're going to have to do a little bit more work to make sure that they stay healthy and that their symptoms are minimal, but they can learn to live with it and be minimally impacted by having that. And I think we need to be changing the dialogues around mental health to think that way too, because there's nothing wrong with also being biologically tuned to having a BFRB or to having anxiety or to having depression or to having bipolar disorder. I mean, these are also conditions with biological underpinnings in the same way as diabetes or other kinds of chronic health conditions. It's really no different. We just have different attitudes about them.
And if I can just add from kind of a social and health policy perspective, um, I think a lot of it is really fighting for um, better mental health policy. And so legislatures, lawmakers, things of that nature that will make it so that access is a little bit more law when it comes to, for example, having more clinicians of color or from more diverse backgrounds. But as someone who, still needed help, regardless of whether a Black woman was in the room, I would say get the help where you can get it, advocate for yourself, and supplement what you're not getting. So, for example, as a health coach, one of my clients, for example, has a therapist. They work, they get the treatment, but because their therapist is a white woman, they feel like there are other aspects that they just cannot grasp or are just not grasping. And so I kind of work with them on kind of the cultural element and just like really just sit there and talk with them about their experience. And so I think there are certainly ways to supplement what's not there, because unfortunately, we're not going to be able to change in a year, 2, 3 years time the percentage of Black folks, brown folks, whoever, clinically. But there are things that we can do to alleviate the pain even just a little bit. As much as as much as you can, as much as you're comfortable with, right? You don't want to, distress yourself even more working with someone who just is incompetent or doesn't, understand. But that is kind of the route that I went. And it has worked for me. When I got therapy for my BFRB, it opened up so many things. I found out that I had PMDD also. I found that I had ADHD. And so all these things kind of opened up things for me. And then I just started noticing the interconnectedness of everything. And that's how I kind of came into this work. And that's why I'm so passionate about it. And even though they were a white clinician, I'm still so grateful for just them opening the door. And yeah, so I think when we kind of think about socioeconomic status and health policy and kind of more things on the public mental health realm, I think that is so necessary in tandem with the clinical realm. And so that's why I think partnerships and collaborations such as this really work. And I think that's truly what's going to get us to where we finally need to be.
Yeah, I agree. I think that was really well put. I think there's so much work to be done on so many different fronts, that it's an all hands on deck kind of problem. And there are good people in these different areas that are doing the work. I know it can seem like there isn't, but there really are. There are people doing the work, and there are resources out there. There are books, there are online courses, there are like decent things available on YouTube, right? Like that great documentary is on YouTube. You can watch that whole thing. If you type in Bad Hair Life, you can find it on YouTube. There are some really good free resources available. There are free support groups. I mean, my practice runs a free monthly support group. As long as you have an internet connection or a telephone, you can join, and you're in a state where we can practice, which is like 43 states. It's like most states at this point. And we're not the only people. Some of these great nonprofits out there, like Imani, like Picking Me Foundation, like Lighter Foundation, like Change Makers, all of these places are trying to provide free resources for, the people for whom especially there are barriers to accessing care. And
For
that's
sure.
that's going to be a battle for a while, I think, is making sure that people have the care that they need and deserve, really.
Yeah, we're kind of at time here. So I'm gonna go ahead and actually stop the recording.